Thank you for tuning in to the Brach Eichler Talks podcast, where we explore and discuss today's trending legal topics. In this episode, we'll discuss a recent Brach Eichler healthcare law alert titled Important Update for Ambulatory Surgery Centers Nationwide, Mandatory OAS CAHPS Survey in 2025. On the heels of the quarterly membership meeting of the New Jersey Association of Ambulatory Surgery Centers, NJAASC, at which Brach Eichler provided a legal report on the latest state and federal legal matters, it is crucial for all non-exempt Medicare-certified ambulatory surgery centers, ASCs, to be aware of the upcoming changes regarding the Center for Medicare and Medicaid Services, CMS, Outpatient and Ambulatory Surgery, OAS, Consumer Assessment of Healthcare Providers and Systems, CAHPS, Survey, CAHPS Survey. Mandatory implementation in 2025. Currently, participation in the OAS CAHPS survey is voluntary. However, starting in 2025, it will become mandatory for all non-exempt ASCs. The OAS CAHPS survey collects information about patients' experiences in Medicare-certified hospital outpatient departments and ASCs. It is designed to measure the quality of patient experiences in these settings to aid in quality improvement and provide comparative consumer information about outpatient facilities. Survey details and CMS-approved vendors. The OAS CAHPS survey covers various aspects of patient experience, including preparation for surgery or procedures, check-in processes, facility cleanliness, communication with staff, discharge procedures, and preparation for recovery at home. It also inquires whether patients received information on managing potential side effects during recovery. The survey is intended for patients 18 years and older who have undergone medically necessary or elective surgeries or procedures. The list of CMS-approved vendors offering the OAS CAHPS survey is available on the CMS website. Voluntary submission in 2024. In 2024, ASCs may choose to voluntarily submit OAS CAHPS data. This period offers an opportunity to familiarize with the survey process before it becomes mandatory. Impact on reimbursements. Beginning in 2025, ASCs must conduct and submit the OAS CAHPS survey as part of their quality reporting requirements. Non-compliance will result in a 2 percentage point reduction in the annual fee schedule update for HOPDs or ASCs that fail to meet this requirement. Therefore, it is imperative to develop a plan and train medical and operational staff on how to effectively approach patients and encourage survey participation. Public reporting of survey results. The OAS CAHPS survey results for both HOPDs and ASCs will be accessible on the data catalog at data.cms.gov. Additionally, these results will be publicly reported on the Compare tool at medicare.gov starting in 2025 for HOPDs and 2026 for ASCs. Exemptions. Medicare-certified hospitals and ASCs that treat fewer than 60 survey-eligible patients in the year preceding the data collection period have the option to submit a request for exemption from participating in the OAS CAHPS survey. The Participation Exemption Request, PR form, and related worksheet is available on the OAS CAHPS website and in Appendix R of the Protocol's Guidelines Manual. The PR submission is required during the mandatory submission period, but not currently. An additional exemption applies for ASCs that had fewer than 240 Medicare claims, Medicare primary and secondary payer, in the year prior to the data collection year for the applicable payment determination for the same time period. ASCs will not be required to submit a participation exemption request form for the OAS CAHPS survey for the same time period. ASCs are encouraged to take proactive steps now to ensure compliance with the upcoming mandatory OAS CAHPS survey requirements and to maintain their quality reporting standards. For additional information about the OAS CAHPS survey requirements or any other healthcare-related questions, please contact Isabelle Bibet-Kalinyak, Esquire, Vice Chair Healthcare Practice Group and Partner, Brach Eichler L.L.C. at 330-554-4133 or ibk@bracheichler.com. This is intended to provide general information, not legal advice. Please contact the authors if you need specific legal advice. Don't forget to subscribe to our podcast on Spotify, Apple Podcasts, and YouTube. Follow us on LinkedIn and Facebook for updates on new episodes. For more information and resources, visit bracheichler.com. Brach Eichler L.L.C. is a full-service law firm based in Roseland, New Jersey with over 80 attorneys. The firm is focused on the following practice areas: healthcare law, real estate litigation, trust and estates, business transactions and financial services, personal injury, criminal defense and government investigations, labor and employment, environmental and land use, family law services, patent, intellectual property and information technology, real estate tax appeals, tax and cannabis law.